to help us learn more about antenatal screening by sharing her expert insights and helping down breaking everything for us. Thank you very much, Doctor, for joining us, and welcome.
Welcome, dear, in our NMC specialty Nahda hospital with the new program for Mabrook baby. For the antenatal screening, it's a crucial issue to assess the woman and the baby. So you can predict who is liable for complications. If you predict that the mother or the baby is liable to some complications, so you can prevent, you can manage, so it's life-threatening in some conditions. And it differs from screening to diagnosis. Screen, it means that you are predicting, so you are assessing, giving some blood test, some radiology, and it came positive. So you have to go for diagnostic, which is confirmatory test.
Wow, so you've already shared with us, what antenatal screening is, but how is this different from the regular diagnostic during pregnancy?
It's regular, that is it's crucial to differentiate between two categories of pregnancy, low risk group and high risk group. So from the first pregnancy test, you have to assess this lady if she has low risk pregnancy or high risk pregnancy. And this comes through many steps. It's not only lab test or radiology. It is by assessing the woman, SNT, body mass index, if she has medical condition, her parity, her age, her SNT, if she has previous history for diabetes, for hypertension, for renal disease, for thyroid disorder, for thromboembolism, if she got any clotting problem, if she has any DVT history in previous pregnancy or in surgery, if she has family history for hypertension, diabetes, all these assessment issues. Then we will proceed for laboratory test for the mother, then laboratory test and radiology for the baby. From this series of history, examination, lab test, radiology, so we can categorize if she is low risk or high risk. If she is low risk, we will see this lady every month till the end of the pregnancy, then every week till delivery. She is low risk, can be managed in secondary care unit. But for high risk, she has to be managed in tertiary care hospital like our hospital, and she has to be seen frequently. We have to offer her more laboratory tests, more radiology. So that is the main difference.
So it's like mainly different for different cases and like different people, right?
Some people can be managed by midwife. Some people can be managed by specialist. Complicated case has to be managed by consultant people.
Yeah. And what stage of the pregnancy is usually when you have to do this antenatal test, and like what are like any specific diagnostic tests that's included in this?
See, once you got pregnancy positive, inshallah. So you have to be assessed by your obstetrician. And after the categorization, so we can proceed for some lab tests and radiology. Before 8 weeks, we have to confirm for the baby if it is viable or not, if it is single or multiple, if it is inside the uterus or outside the uterus. This first before 8 weeks. At 10 weeks, we have to give walking investigation for the mother, blood group, virology, full blood count, ICT, all this basic investigation for the mother. And for the baby, we have to collect an IPT test. That is for chromosomal anomaly. And for somatic abnormalities also, we have to offer the baby ultrasound between 11 weeks to 14 weeks. During that ultrasound, we are checking for both mother and baby. For the mother, we have to check for the cervical length, if it is short or long, if she needs cervical circulage or not. For the baby, we have to check for the knuckle translucency of the back of the neck, if it is increased or it's normal. So we can give her clear plan for the frequency of visits. If we find it abnormal, we have to confirm that is the diagnosis by either chorionic villus sampling before 15 weeks or amniocentesis. Amniocentesis, it is collection of fetal cells from the amniotic fluid surrounding the baby. So by this way, we can confirm if this baby is healthy or not. We can confirm the chromosomes. For somatic abnormalities, we we have to confirm it by the radiology. 4D through fetal-maternal unit. So if we detect any abnormality, we have to refer for fetal-maternal.
Wow. So it detects all of these.
It's a complicated issue.
Yeah. So I was actually coming to that question that, how important and crucial, it seems very important and crucial in the prenatal care. And then, what are the early detections? Like, I think some of them you've already mentioned that, what are the early conditions that it will detect?
Yes, we have to predict all these conditions for the mother and for the baby. If you predict and you, such woman with body mass index more than 30, weight more than 90, you can put in your mind this woman is liable for infection, abortion, congenital abnormality, diabetes, hypertension, gestational diabetes. So we have to screen for all this. At least we are for people with history for gestational diabetes, we have to do fasting blood sugar. If it is elevated, we have to proceed for confirmatory test, which is oral GTT. For the woman with recurrent miscarriage, we have to check for the cervical length. We have to check before pregnancy even. For the reasons, we can go for multidisciplinary team with our colleagues for the rheumatology, for the immunology, to detect the reason for that recurrent miscarriage. So it's not just easy, I'm pregnant, so I'm going to follow. No.
Yeah. Yeah. I think it also must be helping the parents in a lot of decision making, right? Like, with all of these things.
For sure. That is the patient and her husband right to know what's coming. She is coming for the doctor.
Correct.
To know what is coming. She want healthy baby. Also,
of
doctor
course.
want uncomplicated course of pregnancy. So that is her right to go through this safe journey. And her right every visit to know what is her situation, what is the baby situation. And also to be informed about red flags.
Correct. Yeah.
Once you have this or this or this, please come urgent. Please call urgent. If you have severe headache, if you have bleeding, if you have leaking, if you didn't feel the baby movement for 2 hours, please come urgent. Don't wait for the next follow-up.
Yeah. Thank you, doctor. That's like so much good information. I think my last question is around what are the risks associated with antenatal screening and how do parents prepare mentally and emotionally for this journey?
See, it is the issue that if you are predicting something with unhealthy baby, psychological effect, it's very bad. You want to confirm this. Say, during knuckle translucency, you find something abnormal, so we are recommending to go for chorionic villus sampling, that is taking biopsy from the placenta under ultrasound guidance to collect true fetal cells, and also it might be by amniocentesis after 15 weeks to collect fetal cells from the amniotic fluid around the baby. So to be more accurate, when you have fetal cells more accurate, you can predict about chromosomal abnormalities and you can confirm. During this journey, first of all, chorionic villus sampling and amniocentesis carries the risk of abortion less than 1%. We have to explain this to the parents. And most of them, they are accepting because they are eager to understand what is the situation inside. Did we get healthy baby or not? Unfortunately, if you are telling the patients about this risk, is a lot of psychological effect, especially for the mother. During this journey, you have to support her through psychology. Sometimes we are in need for psychiatric management. So that is the role of the multidisciplinary team. Don't just give her a bump and let her to die. No, if you are giving her this issue, you have to explain for her what is further, what's next. She must have clear plan. So our hospital offering this multidisciplinary team. We have psychological assessment, we have psychiatry, we have our neonatology, we have one of the best in ICU in Dubai. So we are referring them to fetal-maternal or referring to the neonatology team. They will explain for them what is the risk, how to manage for the baby, what is the next. When you have clear plan, you will be satisfied at least.
So there's so much learning, and I'm sure there's just different journeys for everybody, like the couple and the mother and everyone. But what's that one golden advice that you would give all your patients?
The golden advice, see my dear, once you get pregnancy test positive, select the correct place
Of course.
where you follow your pregnancy. And when you meet this obstetrician, the doctors, she has to go through your history, medical examination, assessment, lab, and clearly every time you have to know what is your status, what is your baby status, and what is the red flags you have to come back urgently, and is you are low risk or you are high risk, and then you will decide what is the plan for management for you and your baby. If there is any complication happen, what is the best place to give birth for my baby, which will give me safe birth, uncomplicated journey. And always they told us, don't tell the mother that you have healthy pregnancy, you have healthy baby, except after 6 weeks after delivery. Not during pregnancy, not during delivery, not immediately after delivery, because some complications might happen also during period.
Absolutely.
So you have to be in safe hand with safe journey, and that is your choice.
Yeah. Thank you so much, doctor. I think we have covered a lot about antenatal screening, and I would say that I hope you enjoyed this podcast. And until next time, thank you.
I feel you enjoyed more.